Do you ever wish you had more energy? The energy that we experience daily relies primarily on three factors, kind of like a three-legged stool. If one leg is shorter than the other or is non-existent, we are thrown off balance and we have an energy crash. In this short video, we're going to show you what these three supporting leg factors are, the fastest way to get them handled, and get back to enjoying an awesome life. So with me, I was in for my blood work, and my cholesterol was a little on the high side, not way over the benchmark, but it was above where we wanted to be. So we had the discussion how to control it, homeopathic, just naturally, just with diet, nutrition, exercise, and just controlling it that way. So my goal is to have my numbers down by July. It's May now, and my birthday, my 52nd birthday, is in July, so I want to see what I can do there. I've already upped my game since that appointment a couple months ago. So what are some of the things number one, we talked about exercise.
Right. Yeah, so we're talking about reducing in general, when we're talking about cholesterol, we're talking about reducing your overall cardiovascular risk. One of the big things we're trying to prevent. The number one killer in America is cardiovascular disease, heart attack, strokes. And so when we're talking about this, and this is where diet and exercise is of utmost importance, we no longer look at cholesterol and heart attacks as a plumbing issue. It's not a plumbing issue of plaque or cholesterol getting into the arteries. That's what's going on, but it's not a plumbing issue to where you just need to go ram an angioplasty balloon and blowing up that balloon and smashing that plaque into the coronary artery. And so it's really this is really a preventative measure of how do we prevent those things from happening down the road. Where are you at today? I'm looking at cholesterol numbers, so exactly. And as we talked, what I like to quote is James O'Keefe, this preventative cardiologist, that says, if we could take all the benefits of exercise, packages it up into a tiny pill, it would be our most powerful medicine to prevent heart disease, hypertension, cardiovascular disease. So I think we need to think of, so I'm in the clinic with patients trying to not think of exercise as just subtracting, an arithmetic problem of subtracting calories, but really this is really the most powerful medication. It's natural. People don't want to take a pill. And so if we can at least start with that and optimize exercise. There's just some really, when you look at exercise, it sometimes can be too daunting. And so as we talked before, 70% of Americans are overweight or obese. The vast majority are not exercising, a large percentage. And so when we talk about someone that you go to the doctor and it's a little bit daunting, you get these numbers and it's not ideal, and we say exercise and eat better and walk out the door. When we get to sit down on prolonged visits, those are the things we like to talk about. And so when you're pulling in life calibration, the exercise is going to be one of the best things you can do for your physical health to fuel all the other parts of your life. Just getting off the couch and walking 15 minutes several times a week. When you're overweight or sedentary or obese and you go from just 15 minutes, you can reduce that cardiovascular risk by up to 30%, which is a huge amount, by just getting up and walking several times a week. You mentioned the cholesterol numbers. The exercise definitely is going to help with that. You have lots of benefits of anti-inflammatory, and then with exercise, it also seems daunting because people, they think that you have to exercise really hard for long periods of time. It's too hard, and they don't do it. And really, exercise is a dose response. It's just like a medicine. Hippocrates 2,500 years ago said if we could just get the right amount of diet and the right amount of exercise in the right dose, and that could lead to optimal health. And we've been trying to figure that out for 2,500 years. And so with exercise, the benefits, it's actually so if you take a J and flip it upside down, the benefits of exercise is a inverted J curve. And so as you get up to about 30 minutes, that J goes up, and so you get the benefits of cardiovascular disease, so reducing your risk of heart disease and stroke. But it doesn't go up linearly forever. And so actually that J curve, once you get about 45 minutes and higher intensity, you actually start to get that benefit to go down. So I think when you put a parameter on exercise, all you gotta do is 30 to 45 minutes, 3 to 4 times a week, then I think it's much more attainable. And so I think those are, when you talk in those terms of exercise, it's much more tangible. People can understand it. And it doesn't have to be something you don't like, but getting outside and playing golf, walking the course, playing tennis, playing soccer.
Healthy fresh air, sunshine,
Yeah,
a nice dose of vitamin D.
and with people, and so you get that social part
Yeah.
on it too, which is it goes over into, it marries the personal side of the life.
Mhm.
And I think you leverage both of those two together to get a 1 + 1 = 3 result.
See, that's what I've experienced in the past, and I did the big gym thing for about a year, and I had a trainer, and those were hour-long, sometimes longer training intervals, and great trainer, great facility. But what I found is that I was fatigued afterwards, and I didn't have that energy boost that I would want out of exercise, because you get that brain chemistry boost in there, the dopamine and everything that naturally occurs.
Yeah.
And so what I found is when I changed up my exercise routine to doing less intervals, getting up to that 20-30 minute curve, I was feeling energized.
Yeah.
I was getting the benefits from it. And I wasn't wiped out for the rest of the day because I did this huge workout that morning.
Yeah.
And so I agree. Now, you were telling me kind of the guidelines of 145 minutes to 150 minutes a week.
Yeah, those
is
are
beneficial.
those are when you look at cardiovascular, the American Heart Association, American College of Cardiology. So those are based on large studies of trying to get 150 minutes per week. But the nice thing about that is, again, the 30 to 45 minutes. So if you did that 30 minutes 5 times a week, great, or 45 minutes 4 times a week. That 150 doesn't have to be such a hard barrier to obtain, and that's something to work up to as well. So
Okay.
I always like to keep things very simple. Pick the low-hanging fruit that you can do. Get up, start moving. Once you feel better, then the next day you can go a little longer.
Awesome.
Yeah.
I know, on the nutrition side too, takes a lot of discipline. Holly, my wife, and I, we've gotten better at it, but the consistency is the tough part. But I know there's natural foods out there that will lower your inflammatory response in your body, and there's natural foods out there that will do that, like turmeric and ginger and some different things that I'm learning on the nutrition side that just do that naturally in combination with that. But it's you fuel your body for that day. You eat well that day. Well, you burn through that fuel.
Right.
You start over the next day.
Yeah.
So it's that consistency that's tough.
And I like that you brought up, we first started talking about cholesterol, and you have numbers on the paper, and what does that mean? And we talked about diet foods that are anti-inflammatory. And really we have to look at cardiovascular disease or plaque buildup and clots inside the arteries. The best analogy I like to use now is actually acne, because it's something you can see. You say, how does acne and cholesterol go hand in hand? But if you just kind of understand what's going on with acne, it's not an infection like cellulitis or an abscess or what people know as a boil. Let's just go to acne, because you can see it, it's on your face, and you know what it is, and a lot of people experienced it. And so inside the pore you have these keratinocytes, and you get infiltration of sebum, which really is about the same as sebum is the white stuff inside of a pimple, but before that it's usually just like the oxidized LDL and triglycerides, and so it's this little fat plug that gets in there, and it gets inside the lining of those pores, and as it builds up, it actually alerts the immune system to come in, and you get an immune inflammatory response. And so a lot of things in our body that goes disarray, it's the immune system way overreacting, and so the immune system comes and brings macrophages in because it thinks it's being infected by this bacteria. So we also have bacteria inside the acne pore that proliferates with that sebum. So you get this inflammatory reaction that builds up into a pus, and you get a whitehead, and you get loss of, and then as that gets severe, you get loss of collagen and that acne scarring. So we can see that going on, but inside the arteries, the same thing. So we measure the cholesterol, you get that oxidized LDL and triglycerides inside the endothelial layer. It builds up into a plaque, if you will, and the immune system comes in and recognizes it and kind of attacks that. And so when it ruptures, the body thinks that you've got a blowout of your tire, and it thinks it's bleeding, and so it rushes in with all these platelets and blocks that. And so what two things you're trying to mitigate is that inflammation side of it, that's thinking that the artery lining is being essentially infected, and so it has an overwhelming inflammatory response.
And
so
it's trying to protect itself.
trying to protect itself because it thinks it has a blowout, and so that's when you have a heart attack. It comes in and blocks it off and clots it. And so, the two things we already talked about, exercise, and that does have a lot of anti-inflammatory effects, especially when you're not going overdoing it. Probably about 2.5% of people are overdoing exercise, so there's really very low risk of people overdoing it. And so most of the studies have shown, if you look at, it's really hard to do diet studies, but really when you look at longevity, so people that are living longer, i.e. probably not dying of heart attacks at a younger age. The Mediterranean diet is probably the best way when you look at all forms of eating or nutrition. So instead of a diet, look at it as a nutrition. This is a way of live to eat, or eat to live, not live to eat. And so a Mediterranean diet can be fairly simple, lots of vegetables, lots of fruits. In the Mediterranean area, they eat a lot of polyunsaturated fats, so like olive oil, avocados, avocado oil, nuts, seeds, a little bit of dairy, probably more on the low-fat Greek yogurt side, and processed meats is fairly debatable, but avoiding processed foods like grain-fed beef, and most of our industrial agriculture and meat, raising beef and chicken is just what they fed them. And so I think when you can get more of your nutrition from plants, so fruits, vegetables, nuts, seeds, some polyunsaturated fats, you're not getting all that, both sides of the coin. You're not getting the LDL levels that are high and the oxidized due to inflammation. So those are probably the best ways in the studies showing a decrease in cardiovascular disease, i.e. longevity and health. So
I'm a proponent of viewing it not as a diet, but as nutrition.
Yes.
So nutrition to me is far more easier to commit to than a diet. So, there's been so many fad diets and this and that. But the term nutrition is far easier, I think, for me and people to commit to. The word nutrition as opposed to diet has this stigma, like it's this huge thing.
I don't like to frame it of it's nutrition. If you have a expensive car, if you were able to afford a Ferrari, you would probably put premium gasoline or whatever the highest grade in. Mm-hmm. Same with nutrition. You want to get nutrients into every cell of your body.
Doesn't mean you have to deprive yourself of good things in life. It's just be aware of how what you're fueling your body with.
Yes, and there's plenty of this that bleeds over. We're mainly talking about exercise, nutrition, but that bleeds over into the mental health side. There's studies that show this on the same side of depression, anxiety, when people are more on a high carbohydrate, high processed food diet, more incidence of depression and anxiety. Same with exercise. And so these things all integrate together, and your body's one big system. And so if you're not exercising, have really poor nutrition, your body's in this. The whole system is connected, and so the whole, whether it's mental health, your cardiovascular disease, diabetes, it's all connected in one big continuum. So you see, as you pull up on one part of the string, it pulls all the other. Your health is a continuum. You pull up in the middle, and it pulls all up on the rest with you. So your mental health, your physical health, and So I think those are the keys. When you're looking at a life calibration, definitely one part to not only not neglect, but put a large amount of time and effort and allocated assets to, because this is going to fuel the parts of our life that are really important to us, which is our family, our relationships, our family, and able to do our jobs. If you're leading a business, well, you've got too much to do. You have too much energy, far too high energy need to not exercise, and so really becomes a necessity to fuel the rest of these parts of your life.
If you like this video, please hit the subscribe button below to be notified of our upcoming videos. If you are looking to level up your life, click the link in the description to visit our website and download your free life calibration workbook. This tool is your framework for identifying what's missing, refocusing your effort and energy, and systematically improving the quality of every area of your life.